As we brace for the worst of the COVID-19 pandemic, the big fear is that it will overwhelm our healthcare system like it's doing right now in Italy and Spain. We may not have enough facilities, and just as important, we don't have enough doctors or nurses, staff. Which brings me to AMN Healthcare, a managed service provider that helps hospitals handle staffing. While it's not getting a huge run over the past week, it's given back those gains in a brutal sell-off over the past couple of days, and this is about as brutal as I've ever seen. But right now, I'm less concerned about the business side of things and more concerned with how they can help our healthcare system hold the line during this period of extreme strain, maybe the most extreme our country's seen. So let's check in with Susan Salka. She's the president and CEO of AMN Healthcare Services to get some insight into what's happening here. Ms. Salka, welcome back to Mad Money.
Thanks, Jim. I appreciate being here with you tonight.
All right, let's first start with some news. You just put up a site for healthcare facilities for professionals who are caring for patients during this crisis. Tell us about it.
Yeah, Jim, as you can imagine, it is all hands on deck for the healthcare industry, and that's certainly true for AMN as well. We're working 24/7 and bringing in additional resources and redeploying resources to make sure that we can really be doing everything possible to help in this crisis. And so first, I'd like to really thank our team members and leaders and our healthcare professionals for all that they're doing. These are unprecedented, dynamic times. Things are changing literally hourly, daily, and I can tell you everybody is leaning in hard. You know, when we think about our healthcare professionals in particular, you know, they are at the front lines, and certainly we are seeing more and more healthcare professionals pour in. Just in the last week, we have had thousands and thousands of healthcare professionals reach out to us asking how they can help. And on the other end, we have thousands and thousands of jobs from our clients and new clients that want us to come in and help. And our job is to get those resources quickly matched and deployed. And again, I'm so proud of the teams, but you know, we always want to hear from more clinicians, and so that's why we put up the crisis hotline and website. In fact, if there is a healthcare professional out there and they don't know how to help, maybe on a local level, they can reach out to us and we can quickly get them deployed. You might have the site up there now, but if not, I'm going to read the site for you. It's coronavirus.amnhealthcare.com, or you can call in to our crisis line, which is 800-887-1456. This is also for healthcare facilities that might need our help.
Okay, so Susan, I'm watching, I'm sure like you, I've just, whenever Dr. Fauci talks, stop and listen. I was watching him being interviewed by Mark Zuckerberg. I follow him wherever the heck he is on Facebook. And he just said, listen, there's some areas that are basically that are overwhelming the system. I mean, what is going on, say, in the state of Washington right now?
Well, we certainly have hot spots, and if you see the website, you'll see we are posting every day where we have the largest increases, just to try to orient people to where they're needed most. Certainly Washington, California, New York are at the top of that list, but quite honestly, we're seeing increased needs every hour from almost every state within the country. Nurses are at the top of that list. Pretty much all nursing specialties are in very high demand, but also respiratory therapists, lab technicians, and then in the physician front, primary care, advanced practice, radiology. We also have some clinicians that have been displaced. As you can imagine, there's not a high demand right now for dentistry with elective surgeries being called off. We have surgeons and anesthesiologists who are available. And again, they're leaning in and offering up their skills because clinicians can do other things than their normal day job. So we need to find ways to make sure that we're maximizing the healthcare professional workforce that we have across the country. I've also, by the way, been very, very impressed with several of the states that have stepped forward to change and flex the typical licensing restrictions. And we're seeing New York, for example, just announcing that they're going to be accepting healthcare professionals with licenses from other states. Every day, we're talking with state and federal officials to see how we can help and bring our expertise or technology to the table, but also around this issue of licensing. We have a unique perspective and knowledge about how we can most expeditiously move our workforce around the country. And I'm starting to see it happen, so it's very encouraging.
I was on the phone to someone who has built a couple of hospitals, and they were telling me, listen, the nurses don't have the equipment, they don't have the clothes, the doctors don't have the clothes, that it's just a colossal misfortune. What do you tell your people? How do you protect the people who are working with you?
It's very, very important. You know, I know everyone's worried about themselves and their families, but we need to be very concerned for our healthcare professionals. So as you can imagine, we go through screening prior to any clinician going to an assignment, and then a healthcare facility does their own screening. When it comes to equipment, we're working with the healthcare facilities to ensure that we are informing our clinicians about what they have, what they might need to bring with them, but then also wherever we can be helpful in the supply chain, we're trying to make those connections. We're not in that business necessarily, but we all have to try to help in whatever area we can.
You know, I have tried to be as constructive as possible about this because I think that all the professionals are working very, very hard. But there is a bit of disconnect for me. Maybe you can fill me on how it happens between when I watch Washington, and they always seem to have it that, you know, everybody's got everything they need, and then I get called in by people saying, do you have any extra masks? The healthcare professionals don't have the masks. So I'm confused about the disconnect between some people who think that it's everything's smooth, and I bet you your people are saying, I'm not being given the tools I need.
Well, you know, again, we need to focus on what we can influence,
Right.
and what we can influence in Washington and at a state level are things like licensure and the mobility of the workforce. And so that's where we've had the greatest voice. And quite honestly, just on a daily basis, I think we are making progress. I'm told there might be an emergency rule coming out on a federal level that would create more of a national licensure capability. Right now, it's happening on a state-by-state level. But there are other things that we can do and are doing to bring some of our tools to bear and help the country and our clients. We have technology tools that we have offered up for free that will enable clinicians to upload their credentials so that if they want to go to a new facility, they can more quickly accomplish that. You know, for example, I mentioned Silversheet, I think, on one of our prior discussions, which is a cloud-based physician credentialing platform. Right now, physicians can go there and for free upload their credentials, which will make it much faster and easier for them to go to any new facility across the country. Since we last talked, we also made a couple of other acquisitions in the tech space. One is B4 Health, which helps healthcare organizations, which can include a state hospital association, to quickly match where the needs of staff are and where qualified staff exist. And so we're working with various state associations right now to try to equip them with that technology so that they can more easily move around the very precious workforce that we have. And then just finally, Stratus Video is an acquisition we made earlier this year, which is primarily for video interpretation, but we quickly pivoted and added capabilities so that our clients could use that platform for COVID-19 triage purposes so that their own clinicians wouldn't necessarily have to be in the same room with their patients. And it can be used in a variety of other ways. So, you know, I could go on and on the things that we're doing, but hopefully you get the idea that everybody, our whole industry, is leaning in very hard on this.
I'm just glad you're doing it and you're a seasoned hand and they need you. And, you know, I hope the weekend goes well. In the next few weeks when we're at war, you're at the front lines. Thank you so much to Susan Salka, President and CEO of AMN Healthcare, friend of the show for a very long time. Keep doing what you're doing. Really appreciate it. Mad Money will be back after the break.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.